This is a guide to local support for children and young people with special educational needs and disabilities in Nottinghamshire. Its purpose is to illustrate the services available from 0 to 25 from education, health and care agencies to help you understand what is available across the system. This animation will focus on the 17 to 25 age range. While we introduce the support available at particular ages, it is important to note that some services will work from early years to post-16 ranges. You can revisit the full map for this information or watch all the videos for a wider picture. Support from 17 to 18. All schools receive funding to meet the needs of young people with SEND in their school budget. Many young people with SEND get the support they need through these processes. However, schools often need extra help to support the young people with the most severe and complex needs. If young people are receiving extra help at school to meet their special educational needs, they should have an SEN support plan. For example, Individual Education Plan, IEP, or a provision map, and they should be added to the school's SEN support register. Some further education, training settings or alternative provision may have in-house therapies depending on their individual offer. For some young people with the most severe and complex needs, they'll have an education, health and care plan, supported internships or a structured, work-based study programme for young people with SEND who have an EHCP. The Maximising Independence service aims to improve independence. Promoting independence workers will work with young people approaching adulthood on their goals for up to 12 weeks. It can help with improving skills in the home, budgeting, finding work and keeping well. There is also a transition pathway to provide information, advice and guidance on what should be happening at different stages as a young person makes their way towards adulthood. Specific teams are dedicated to supporting this preparation for adulthood. For healthcare information, there are videos that help to further explain where you might go for advice and treatment. For care-related support, visit a local family hub for weekly activities and support programmes. This may include getting help from a family support worker. You can also find out more about the different levels of children's social care support available online. The Healthy Family teams will also continue to support late teens when they need it, working closely with GPs, family hubs and services in the local area. Support from 18 to 19. At this stage, young people may start to think about where they would like to live. Supported living is for people with a learning disability or mental health need. Supported living is an accommodation that is accessed only through the County Council. It offers both a home and support over a 24-hour period each day for a person with assessed and eligible needs. A personal assistant, PA, is employed to help people who require social and healthcare support. This could be either because of their age or disability and can enable them to live as independently as possible in their home. People who employ PAs are either in receipt of a personal budget through the local authority, a personal health budget through the NHS, or pay privately, who are self-funding. For children in care, Nottingham and Nottinghamshire ICB employ designated nurses who act as an advocate for children in care and care leavers. Up to the age of 18, young people can access community nursing and health therapy services. The Community Children and Young People Service offers support relating to speech and language therapy, occupational therapy, physiotherapy and phlebotomy. Support from 19 to 20. For more support about leaving care, the local offer for care leavers explains the offer for services and support available, listed on Not to Help Yourself. Primary care is the first point of contact with the NHS, which includes GPs and community services. There is also a learning disabilities primary care liaison team that supports primary care services to make reasonable adjustments for people with intellectual disabilities. The service is open to over 18s who are on their GP Intellectual Disability Register. They will also support younger ages with accessing their annual health check. Support from 20 to 21. Anyone over the age of 14 with a learning disability can have an annual health check. A health check once a year gives people time to talk about anything that is worrying them and means that they can get used to going to visit the doctor. Please note that to receive an invite for an annual health check, a person will need to be on their GP practice's Learning Disability Register. For education support, the Disabled Students Allowance, DSA, is there to cover the study-related costs you may have because of mental health, long-term illness or any other disability. This can be on its own or in addition to any student finance. The type of support and how much you get depends on your individual needs. Support from 21 to 22. Personal Independence Payment, PIP, helps with some of the extra costs caused by long-term ill health or a disability if you are aged 16 to 64. An assessment is required to work out the level of help you can get. Community paediatricians are specialist children's doctors and nurses who have expertise in medical and developmental conditions. Young people move towards adulthood, their medical care will also start to move towards adult services. Further health support is available from the local authority, who commission open access, free and confidential sexual health services across the county. In addition to this, some further services are available from participating GP practices and pharmacists. Support from 22 to 25. Towards the age of 22, young people will be leaving specialist colleges. At this age, if not before, young people can access career advice and guidance from a range of services. It is also important to note that if a young person over the age of 16 has been assessed as lacking mental capacity, there may be many different people and agencies involved in making decisions on their behalf, depending on the complexity of the situation. The Mental Capacity Act 2005, MCA, provides a clear framework for parents on who should be consulted in the decision-making process. Up to the age of 25, young people can continue to access a DWP Work and Health programme that helps you to find and keep a job if you are out of work and eligible. The local offer also lists the palliative and end-of-life care services for children and young people with life-limiting conditions and their families. Many of the services discussed will support young people up to the age of 25, including supporting the transition to adult services. You can visit the local offer Preparing for Adulthood pages for more information. This concludes the mapping of support available from 17 to 25. For more information, you can visit the local offer website or watch the full series of videos for the wider picture.